Sarah Madam, really grateful to Bhagwan for sending you to the studios today. Can we go back to your journey of coming to Bhagwan and how it has been to Sai with Sai?
Humble pronouns the lotus feet of our beloved Swami. Truly am very grateful for this opportunity to talk about something which is very near and dear to my heart. Clearly talking about Swami and how he has been a part and parcel of my life during this Janma, and obviously through many, many Janmas, I'm sure. So Swami came into our lives through a picture that was provided to us from a very dear friend of my father. And this picture had made it into our home. There were a number of times wherein I was facing through many challenges in life, wherein I would just kind of open the cupboard, where the picture was, and many tears that I have shed in front of this picture, constantly having to kind of praying for a resolution or a positive outcome for the challenge and the problem that I was facing. That then resulted in me going to the United States, which again was a miracle in itself. Having been to the United States, I ended up getting to kind of visit a number of Sai centers in the US, and that in turn kind of clearly allowed me to get to know more about Swami. And some of the works, whether it was in the socio-care, Medicare, or the educare realm, got a lot of kind of, clearly got to learn bhajans, ended up chanting the Sai Ashtotram, and obviously, as loved to sing. So we would do that as a family, my parents and I, pretty much every Sunday of the week at our prayer room, which then resulted in me attending the first Sai retreat, which was in 1999, and ended up getting to meet two amazing speakers who then allowed me to kind of get connected to a number of people who ran medical camps here in Puttaparthi during Guru Purnima and, of course, Swami's birthday time. So my first trip to Puttaparthi was on 19th of November, 1999. And I say this because this date has had a great deal of relevance to me much later, about 16 years later. Talk about that in a second. So ended up coming to the ashram on the 19th. And of course, the entire universe was in Puttaparthi, given the fact that it was also happened to be Swami's birthday week, convocation, you name it. And so came here, not really knowing what to expect, went to the accommodation office, and of course they said that there were no rooms. So I had this mental conversation with Swami at that time and said that, I come this far kind of to participate in a medical camp, and there is no accommodation. You don't even kind of, make it possible for us to stay here. And as my parents and I stood up to leave, it was as if he had heard kind of the conversation that I had with him. And a gentleman called us and said that, are you all one family? And we said, yes, we are. And he said, we have a room. So that was kind of clearly my first trip to Puttaparthi. Ended up spending the medical camp, which lasted for about a week during that time. And this was November of 99. And subsequent to that, I ended up carving out most of my vacation, which is about 15 days in a given year, around Thanksgiving, which happens to be in November, and then about 10 days during Guru Purnima. So came for my next medical camp in 2000, which clearly was the second trip that I made to Puttaparthi. And during this trip, I had the opportunity to sit in front as a part of the medical camp devotees. And Swami, as we all are very familiar, came from his residence with the backdrop of this beautiful music playing as if he's gliding towards kind of people sitting for his darshan. He came right in front of me, and there was a lady who clearly spoke to him in Telugu and wanted him to bless her daughter-in-law. Swami stands right in front of me, materializes Vibhuti, and ended up giving it to me. And, since I had not asked for it, I did not put out my hand. And of course, we had the Sevadals were kind of trying to make sure I thrust my hand right there as the vibhuti was being materialized. So as a neuroscientist and a psychiatrist, this was the first time that I ended up seeing what I termed at that time as a miracle, kind of materialization of vibhuti right in front of my eyes. And it was a very different kind of vibhuti that we clearly have seen or have had the benefit of receiving. It was a very coarse yellow-colored vibhuti. And so this was my first encounter with divinity, kind of it's clearly close proximity with his physical form. The same visit, we ended up, this was Guru Purnima day in 2000. And Swami again kind of, comes for the Guru Purnima celebrations. This time around, I had ended up getting a set of padukas for myself, as well as another set for my sister, who also happens to be a physician in the United States. So holding on to the padukas during the Guru Purnima celebrations, and Swami comes from his residence and is on the other side of the darshan line. He went past where I was seated, kind of quite a distance away from where I was seated, and I just kind of, consoled myself that having the padukas in his presence was blessings enough. And right at that moment, he came diagonally towards where I was sitting and blessed that set of padukas that I was holding on to. The minute this happened, clearly to me it was like experiencing divinity, kind of just touching those padukas which were being held in my hands. I had a fleeting thought, which was to give this set of padukas to my sister, who clearly couldn't make it during those celebrations. And as soon as I had that thought, Swami went forward and blessed the other set of padukas that I had bought for my sister. So that was clearly an experience which was an unforgettable moment for me, which probably was kind of, in a sense, opening the doors to understanding and being more curious about learning about Swami and kind of clearly divinity and exploring various aspects of it, both from a spiritual lens, a scientific lens, as well as a worldly lens.
So after having come to Swami, and I think perhaps this was the moment when, faith in Bhagwan became firm in your heart, and yes, you went back from Prasanthi as a devotee, yes, perhaps. So after that, as you started reading about Swami, knowing more about him, probably you would have wanted to feel him more, you would have wanted to come back to him more. How was the journey after that? How did you feel him? And what are the opportunities he gave you to experience his presence and love?
So I think it also allowed me to, when we talk about faith, it's just experiences that you have in life that intensifies faith. So there have been many experiences throughout my life, subsequent to that 1999 and 2000 trip, that truly kind of allowed me to understand, Swami being a part of one's life, being omnipresent, omnipotent, and omniscient throughout kind of whatever I did. So to me, it was like whether, as a physician, if I was doing something, it was, work is worship. Offering everything to the Lord was something I got into as I kind of, treated my patients, if I was trying to kind of help another individual. So as I kind of, tried to take this journey of life, I ended up getting to experience Swami in very many ways. Just to give you an example, happened to visit this state of Arizona. This was around 2008. And we just happened to kind of, be there. We were planning to take a trip in Arizona to go to the Old Town Scottsdale, which is where there is a beautiful artists' colony, just to kind of look at paintings and all of that. And that's where we took a car service from where to get to this artist colony. And this gentleman who was driving the car, kind of as soon as we got on board, he asked us where we were from. So we said India. He said, which part of India? We said Bangalore. And he says, Sai Baba. So we were, in awe. We were shocked to see kind of who is this gentleman. Clearly he was, somebody from the kind of the Middle Eastern part of the world. And he said that he had an experience wherein his wife, when she was about 5 years old, had been kind of seeing this individual who had afro hair, orange robe, and she'd been having these dreams day in and day out, and happened to come to a pilgrimage with a group of friends to India, happened to visit Puttaparthi, had a couple of interviews there with Swami, and so she completely was an ardent devotee of Swami. She comes back, gets married to this individual who's driving us around. He happens to be from Iran, and brings him to Puttaparthi. And his experience with Swami was that he'd been holding on to a piece of Quran, sitting in darshan line. Swami comes in and allows him to take Pada Namaskar and takes that piece of paper from or Quran from him. And this gentleman, just getting to know that we happen to be Swami devotees, wanted us to accompany him to his home. So we tried as much as possible to kind of, speak obligingly and say, hey, this might be an imposition, but he was insistent. We ended up going to his place. Just a beautiful kind of, a home with the lady kind of dressed in white salwar kameez with vibhuti on her forehead, had the bhajans playing in the backdrop. So we ended up getting to spend some time with them. And she happened to ask us for our birth dates. Several months later, happened to be my father's birthday, and there was an envelope that arrived from Arizona. So my mother kind of opened the envelope and saw a beautiful picture of Swami, and it was a gift from the couple to my father, wishing him a very happy birthday. So my mother called the couple and said, thank you so much. It's such a beautiful gift that you've provided my husband as his birthday gift. And they were very surprised that, it had traveled in first-class mail. They just mailed it less than 24 hours before, and it had traveled to the state of South Carolina in less than 24 hours. So this was just one such kind of event, just making his presence be felt. Another one was just having, I was at a professional conference. Happened to be there. I just got up to get to the buffet line, come back, got seated to where I was, and then there was a gentleman sitting next to me who happened to be an American. And so somebody introduced the two of us to each other, and he said, "Where are you from?" I said, "Bangalore." And I said, "Have you visited India?" He said, "Yes, Puttaparthi." So no matter where I go, I'm always very careful in terms of, there is some link to, experiencing Swami's presence, whether it is, somebody having visited him, somebody having had an experience with him. So this gentleman, what was interesting about him happened to be a psychiatrist, since it was a professional conference that I was at. And he had come to Puttaparthi. This was in the 70s. He happened to be friends of the veterinarian who treated Sai Gita. So this gentleman came during Onam celebrations. So the family asked this gentleman, if you have any wishes, you can kind of write it on a piece of paper and offer it to the Lord. So which he did, and kind of placed it at Swami's feet. So out of curiosity, I asked him, "What is it that you asked?" If it were me, I would have asked for a laundry list of things, if you're asked to provide your wishes. So this gentleman said that all that he asked for is, "Give me what I deserve." And so he had a transformational experience wherein he comes back to the United States. He ends up getting to be, he quit eating meat. He ended up finding a guru. And thirdly, he ended up playing the mridangam. So he's a fantastic mridangam player. So again, just kind of, experiences and just finding the Lord in places where I would probably have never thought that I would have some kind of a link to Puttaparthi. Then, of course, as during economic recession, clearly I happened to get to be the chair of the Department of Psychiatry where I work. Very difficult times. So to me, it was also during these challenging times is when your steadfast devotion to the Lord gets tested, time in and time out. So while these are challenging times, I think it was also an eye-opener for me is how Swami comes to rescue you every step of the way. I would go into these difficult meetings wherein I would say, well, I only see two options. Kind of, if I do one, I'm going to hurt someone. If I do the other, I'm going to hurt the other person. So when I would pray to the Lord, go in to this meeting, and then invariably there would be a third option, which would be something that I would never even have thought about. And it was only Swami who kind of, showed the way in terms of this option was a much better option than the two things that I was considering. So we were able to kind of get past the financial kind of, aspects of where we were at during 2008, 2010, the economic recession, and how significantly we were impacted as a medical school, as a department. And it was only pure grace of the Lord to be able to turn things around. But at the same time, also an opportunity for us, I think, to be able to kind of, have that intense experience of having faith, which I think over time, it needs to be kind of, there is the experiential part of it. And then there is kind of, whether we term it as miracles or kind of, clearly opportunities. Every moment to me now is a miracle. Kind of just meeting people, clearly Swami bringing people into our lives, into this orbit is just a phenomenal way of kind of looking at the world. It also, I think, provided me with an opportunity to, Swami talks about the 5 values, right? Sathya, Dharma, Shanti, Prema, and Ahimsa. To me, it was about kind of how do we start to apply some of what we have learned into practice. And no matter how difficult the person in front of you is, how do we continue to kind of, pour that love into this individual? And I've had a number of occasions wherein, constantly, I often kind of joke around, say, kill them with kindness and with love. If you keep doing that, give them an opportunity. And sometimes, my faculty is like, Dr. Narasimhan, you shouldn't be doing this. It's like you've given them like 7, 8, 9, 10 chances. It's like, but to me, it's like, God has given us opportunities. He's the greatest role model. If he had written all of us kind of and said, and had given up on us, we wouldn't be here today. So to me, it's like, having him as a role model to be able to say, here is how you love the divinity in another human being. It not only allows you to kind of experience the innate divinity in oneself, but also the innate divinity in others. And Swami is kind of, clearly the embodiment of love and truth. And to me, he has laid out these simple commandments: love all, serve all, help ever, hurt never. But it's for us to be able to kind of, make sure that we practice. I mean, it's very easy to sit and kind of, preach about this. But how do we start to incorporate that into our daily lives, whether it's our personal lives with our family members, but also to be able to do so within our professional space as well. And so that to me is like, of course, as a psychiatrist, we believe in these, cognitive behavioral therapy. But most important of all is how are we able to kind of get some of that, start to apply some of that into our own lives. And that is so very important. I can't preach about mindfulness meditation to my patient if I myself don't do it. So kind of starting with ourselves first before we start to kind of have others implement it is key in terms of, understanding Swami's teaching, but also experiencing his presence.
So may I ask you, after having being exposed to Swami's teachings and, being so drawn to all these values that Bhagwan talks about, what difference did it make in your professional practice? Definitely you mentioned that, the way you deal with people has changed.
Yes.
As a head of the department. But in terms of taking care of patients, in terms of applying these things as a psychiatrist, can I say in some way, from a psychiatrist, now you become a psychiatrist,
yes,
as they always play with this word. But what does that mean for you? And what are some of the experiments that you could do now with the new learnings based on Bhagwan's teachings?
So I think, as I talked about, the 5 values that Swami talks about, so trying to incorporate that, I think the first thing you've noticed is that love is the easiest. It may be the hardest on certain aspects, but it's also one of the easiest that you can, kind of that outpouring of love towards another human being while experiencing the divinity in the other individual. I think that's the one that's the most transformational. Very often when we have these Christmas parties in my department, people will come in and say, the love that you have here is so contagious. So it's not just one human being. It's like, you keep doing it over and over again, and it's just like a contagion. It just catches on. And so that was the first one I think I noticed and then subsequently getting to know Sai Ideal Healthcare as a physician. Now I'm talking about it as a physician. So universal healthcare is something I truly believe in. Free healthcare is so very important. I come from a state wherein 50% of South Carolina is fairly rural. So significant health disparities, right? People who clearly can't afford, can't travel because of, being from the lower socioeconomic strata. And you can extrapolate that to the rest of the world. Trying to look at loving healthcare, right? So how do you provide that with love? Makes a very big difference, right? I can just write a prescription and, diagnose in a human being and write a prescription and give it to the patient versus the ability. Humanism in medicine is so key. And to me, it's like, learning from Swami's teachings makes me a better, not just a better doctor, but a better human being. And that's what I value in life. So clearly, comprehensive healthcare is another. So to me as a psychiatrist, I've always believed, and also clearly from the Eastern philosophy perspective, mind, body, spirit connectivity is so very important. You can't have if there is no connectivity between the three, it's like the three legs of a stool. So one is out of whack, you clearly have a disequilibrium. So to me, to be able to understand the ramifications of the three, and how do we start to make sure that all three of those are addressed concurrently to be able to then allow yourself to treat this human being, which then provides more of a holistic approach versus just a very siloed approach. That's what happens, right? If you go to a cardiologist, they look at the heart and say, well, I know there is a problem. But the heart also has implications on the brain. We know that, people who have had myocardial infarction or heart attacks do go on to have depression. 50% of individuals with MI, if you clearly don't do a good enough screening, you're going to miss that. Similarly, any physical illness, cancer, for example, Parkinson's disease, very high comorbidity with mental illnesses. So hence it was very important for me when Swami talked about comprehensive healthcare, which is you really need to start to look at all three components and how do you get to provide that level of treatment to the patients who is right in front of you. Healthcare across the globe is fragmented. We all know that. So to me, moving from a siloed approach to what Swami talks about in Sai Ideal Healthcare, I think was very refreshing because it also allowed me to take a look and say, well, this is something I believe in. But again, there is also this endorsement from Swami stating that this is so very important. And when you look at just mental health, Swami has said a greater percentage, probably somewhere in the 90% or above, our mental health afflictions result in other bodily ailments that people go through. And I've seen this in individuals. And so that's so very important for us to start to focus on each of these elements to say, how do we go about treating this individual? Because as scientists, as physicians, we are often trained on the biological aspects of medicine, right? But medicine is an art and a science. So we very often are focused on the scientific aspects of it. So how do we start to incorporate the other two legs of the stool to be able to say, here is how we go about treating a human being?
Can I ask you to share any case studies that you have been exposed to when you are trying to apply this principle of being able to take care of the mind and then automatically you see the body being healed? What Bhagwan always talked about.
Yes.
Establishing this connection of the body, mind and spirit, and how the mind plays such a huge role. How if your spirit is high, you can deal with anything in life. Are there any instances that you can share which will help everyone to think of ourselves as that composite being?
So I'll talk about a couple of examples here. So even before I came to the Sai fold, so to speak, I'd seen the relevance of Gayatri Mantra. Right? So Swami talks about Gayatri Mantra. So he talks about Sarva Roga Nivarani Gayatri, Sarva Dukkha Pariharini Gayatri, and Sarva Vancha Falashri Gayatri. So one of my cousin's daughters had an experiment that she was doing. This is, I'm talking about the plant kingdom now before I move to the animal and kind of the, Homo sapiens. So here, what she was doing was she was growing okra, bhindi. So she had one pot which she kind of had that particular plant be exposed to pop music. There's another plant that was being exposed to Gayatri Mantra. So incredibly, the pot that was being exposed to the Gayatri Mantra had like just kind of succulent, long bhindi, okra, versus the other plant which clearly was hearing pop music. So that was my first kind of experience in terms of just looking at the sounds clearly, but also trying to see the significant dichotomy that you see between music. Both are different kinds of music. One is a mantra, kind of clearly pop music, and trying to look at kind of what is the scientific basis for this. So moving forward to kind of as I got to be a physician and as I kind of learned more coming into the Sai fold about the relevance of Gayatri Mantra, I had a patient who clearly had mild cognitive impairment. So this is somebody who is kind of early stages of Alzheimer's, dementias. So taught this, fortunately for me, it also happened to be an Indian. And so much easier to kind of, relate and to talk about kind of the relevance of Gayatri Mantra. And so while I was providing kind of, medications to the individual, but I also said it's so very important, at least if there is a possibility for you to chant the Gayatri Mantra 108 times a day, or if you can do it 3 times a day, that will be even better to be able to do so. What I saw with this particular individual is that couple of days later, when he kind of chanted the Gayatri Mantra, there was a significant improvement in his cognitive status. So I got to kind of see it firsthand now in a patient who clearly had symptoms of mild cognitive impairment. So that was my first experience in terms of getting to see what Swami has been talking about all along. And this individual also has had medical issues. So not just the kind of the approach of trying to look at more of a holistic treatment for the mind, but also how the cardiac parameters also started to improve. So again, the mind-body-spirit connectivity and how all of that comes into play while you are trying to address one component of it, but also has ramifications on the others as well. So that probably was kind of, one such teaching that Swami clearly has talked about. Swami talks about Rudram, right? Rudram and the Gayatri Mantra. He has taught everybody to make sure that, you learn those. And both of those, I think, Rudram especially creates a great deal of positivity around you. So my family and I, we chant the Rudram every Monday. And to me, it's just incredible to see the way in which, just keeping your spirits in a positive way, kind of, that to me has been another experience that we ourselves personally have gone through. But one of the ways in which, we talked earlier about love, we talked about kind of the Gayatri Mantra, clearly looking at Namasmarana is another. So constantly chanting the name of the Lord. These are simple, kind of easy to apply. So to me, it's like, I can't be teaching, our patients that I end up treating things that are more complicated or, something from Sanatana Dharma. It's so very hard to be able to kind of relate to. But things, it could be, no matter what they believe in, which God they believe in, just chanting the name of the Lord. I think that truly proves to be immensely helpful. I'm reminded here of this beautiful story, I think, which Swami narrates about Sakkubai, right? When she is kind of making those cow dung cakes, wherein every time she makes those cakes to dry, she talks about Rangaranga, Panduranga is what she's chanting. She dries those cow dung cakes. And around that time, I think there is Namadeva who visits their village. And so he has heard about Sakkubai, and he kind of starts to have a conversation with her. And she tells him that, somebody has been stealing my cow dung cakes because, it's a common area that they've been kind of drying all these cow dung cakes. So Namadeva asks her, how is it that, it's your cow dung cakes that are being stolen? It could be your neighbor's cow dung cakes. she goes in and brings one of the cow dung cakes that has been left there to dry, and brings it to Namadeva. He holds it close to his ears, and from the cow dung cake reverberates Rangaranga Panduranga. And that to me is like even an inanimate object like a cow dung cake can reverberate kind of the name of the Lord. To me, you can just think about kind of the positivity that would have spread around, no matter how difficult Sakubai's life was. Right? We can put ourselves in Sakubai's shoes. Each one of us faces challenges, especially during COVID. We've all experienced that. So to be able to kind of constantly, we have examples throughout history. Swami has talked about this. Nothing better in this Kali Yuga than Namasmarana. To be able to kind of incorporate that as a part of our treatment regimen, as physicians, when we kind of offer that to our patients, I think is another incredible opportunity and service that we can render to our brothers and sisters.
Can I ask you from a neuroscientist perspective, when you do Namasmarana, when you chant the Gita, or when you chant Gayatri Mantra or chant Rudram, what happens to the chemical structure of our body? Can you share some light about what goes on inside our brain and how these help in ways that probably we are not aware?
Yeah. So there's, I think, some very interesting literature on looking at the Gayatri Mantra, for example. So there's an interesting study which was done wherein there are 3 cohorts of individuals. One is those who clearly chanted the Gayatri Mantra in Sanskrit. Another group which clearly chanted it in the English translation of the Gayatri Mantra, and a group that did not have any of those. So when they subjected them to a magnetic resonance spectroscopy, so trying to look at the functionality of the human brain, what they found that the group that chanted the Sanskrit version of the Gayatri Mantra, they clearly had any asymmetry in the human brain, right, left. There's always, it's asymmetrical. That symmetry got to be rectified, which is truly fascinating. So again, when you chant mantras, there is also a release of endorphins. The brain is an extremely complex structure, organ of the human body. Great deal of crosstalks that happens between receptors. So you have, if you're looking at somebody who has depression, you have serotonin, norepinephrine, epinephrine, all of these play a significant role in the causation of depression. So when you look at whether it is Namasmarana, whether it's Gayatri Mantra, whether it is chanting of the Rudram, all of these do cause a significant kind of change within the neurochemistry of the brain, one. It causes a significant, improvement in the functional aspects, which is the cerebral blood flow to the brain, right? So if there is more blood flow to the brain, there is also the chemicals are being rendered to those regions of the brain. Like, for example, in depression, the serotonin kind of could be significantly deficient in patients with depression, or norepinephrine in certain patients. So again, there is a significant impact of these mantras. Clearly, bhajans is another way of kind of trying to create that level of positivity, which then has implications at a biological level within the human brain.
Wow. So in these times when we are so much focused on improving our immunity, because we don't know what other wave of infection is going to come tomorrow.
Yes.
And it's so very important for us to be on guard and protect ourselves in these environments. So what is your perspective on all these spiritual practices that Bhagwan has given us and in maintaining our well-being?
Yeah. So there is this field called psychoneuroimmunology. So as we talked about the mind-body-spirit connectivity, so I think, when you look at one's immunity, clearly if you have, let's say, mental illness, or you have a physical illness, that clearly can bring down your immunity. So all of these mantras do help in terms of boosting that immunity. It's just like a vaccine is how I would describe it, right? When we all ended up getting the COVID vaccines and boosters. So to me, it's like, how do we improve that immunity? And there is a simple way of doing it. And how do you do it? Like, just what we talked about, the Gayatri Mantra, Namasmarana, kind of, Rudram chanting. All of those do improve one's immunity, which then has a significant impact on their own well-being, whether it is mental well-being, their physical well-being, and spiritual well-being at some point. So all of those coming together. And I think that's so very important for us to clearly understand and be able to, try to have that be incorporated into our daily lives and routines. During COVID, I mean, it's not like, our patients experience. I experienced it. There were a lot of challenges that we were day in and day out. We had to be there. We couldn't do it virtually as physicians. And so we had to be there. And there were times wherein I got to be anxious. Talk about a psychiatrist having like panic attacks. So I got to be anxious. So I would kind of be in bed just with your heart pounding. It was overwhelming, not knowing what we are going to be taking home with us, the virus, because we had to go to work. You have family members, elderly family members at home. So, and of course, you have work stress, all of that. And so to me, that's when I found that just chanting the Gayatri or just chanting the name, pick any name of the Lord. Just chanting that truly helped kind of put a damper on that kind of the increase in the heart rate that I experienced, and also the way in which the mind starts to play games on you. So kind of first-hand experience, right? It's not about kind of doing it to a patient or kind of, hearing it from a patient, but also kind of just experiencing it. So that to me was that aha moment that said, well, if I can do it, this is something you really need to be kind of, providing as a part of that prescription to your patients. And that was so kind of, clearly a surreal moment for me as I kind of, underwent through some of that during these challenging times during the COVID pandemic.
And talking about Bhagwan's philosophy and message, Seva plays such a huge role in all the activities of the Sathya organization.
Yes.
And, it is something that is done by every member of the organization. Can I ask you to share your thoughts on what does Seva do and how should we do Seva?
Yeah.
And what does Seva do to our neurochemistry?
So to me, it's like, when you talk about Seva, so it could be, Seva could mean a multitude of things for multiple people, right? So it could be, for me, it could be, not just helping people at my home, but it could also be how I render care to the patients who are around me or to my colleagues. Or it could be kind of what, is conducted as Narayana Seva. So that is another form of Seva. So Seva, again, clearly has a multifold kind of way of manifesting itself in terms of how an individual goes on to render that. So so to me, it's like, I think being able to do things for others, we often think about it as, benefiting the other human being who is clearly at the receiving end of it. But in a sense, it's benefiting you. So the one who is doing the seva is the beneficiary of the service being rendered. I mean, we all feel good when we do something nice to, another human being. So I think to me that has been, again, I am not sure about, I'm sure there are studies which have looked at that component of it, but to me it's just that sense of fulfillment, that sense of doing something to another individual. That to me is truly gratifying.
And if you look at the world today, with the onset of the current comforts and conveniences and the gadgets, even as the world is more connected, at the same time, you have high rates of loneliness, you have high rates of depression, there is so much of distraction. And you have Bhagwan here with his message, with so many practices that he has been trying to instill into us. What would you like to say to the youngsters of our times from a neuroscience perspective about the relevance of all these practices?
Social isolation is what we saw during COVID, right? So it was physical distancing, but also the social isolation. And man is a social being. We all know that. So to me, the kind of having lost that rubric of kind of the society clearly can result in that downward spiral. And what does, clearly when you look at the Sai organization, Swami has emphasized the importance of Satsang, right? Being in good company, trying to kind of, have good practices that we can all do together, whether it's singing as a part of that Satsang kind of bhajans, or whether it is kind of trying to chant mantras, trying to, if you are to do kirtans, doing all of that. And so to me, it's like, I think trying to be able to have the spiritual aspects of life which Swami has taught us to be incorporated not just as an exercise, but also it's a lifetime commitment and a lifestyle change for each one of us. We may not realize that because, in today's world, there is so much of there's this shiny object here and there, lots of distractions. But having that level of grounding, which kind of clearly is what the tenets of which have been laid out by Swami, is so very important. Just pick a few. You don't have to do it all. I can't do it all either. I just pick a few which I think I can easily implement into my life. And then you start with that scaffolding to be able to add some more. And it's hard for, especially youth and children of today's day and age to be able to kind of say, why do I have to spend time kind of going to, Sai bhajans or attending kind of Satsang group? And to me, I think it's important. And each one of these kids, I know for sure that there are parents who approached me, there are kids who have approached me, stating that, we are either anxious or we are depressed during this pandemic. And so to me, it's like, how do we keep bringing that dial back to Swami and his teachings is extremely important. The rates of depression, anxiety disorders pre-COVID to during COVID is 3 to 4 folds higher. It was already high to start with, but kind of clearly during COVID, those numbers have come up. You can't really put out mental health providers at the pace at which the rates of depression, anxiety are growing. So to me, you really have to figure out a way in which what is it that's easily available. And this is so easy to practice what Swami has laid out. You don't have to be a scholar to figure these out. He has simplified things for us. And, you talked about COVID. Kids are looking at social media these days, right? Constant news cycles. All of what we were all exposed to. Kind of sometimes good information, sometimes misinformation. Which, again, goes back to what Swami has said. Food that we eat affects our mind. As is our mind, so are our thoughts. As are our thoughts, so is our conduct. And as is our conduct, so is our health. He's laid it out. Can it be any simpler than that? Right? So to me, it's like this is exactly what we should be doing. Whether it's parents trying to get there without coercing them. Coercion is not going to help. So how do we get these kids to understand the relevance of it? By saying that you don't have to kind of, it's not about, sitting there 30 minutes chanting the Gayatri. Even if you start, it's just like brushing your teeth. That's how cognitive behavioral therapy is done. In the beginning, we have got to be told, you have to brush your teeth. You've got to kind of, make sure to have good oral health. But then we get up in the morning and do it, don't we? Similarly, any habit that we incorporate into our lives, it's important for us to kind of take baby steps, not to give up. Very often, parents give up. And I think that's so very important for them to kind of be there with the child. And very often, it's also the child says, my parents don't understand what I'm going through. Which could be true to an extent. But then how do you create that environment, that psychosocial support? Right? That's where Satsang comes into being, to figuring out kind of a way in which how do we make it more conducive for the child to share things. So this way they don't feel like they're being penalized for sharing it, or kind of trying to stigmatize mental illnesses, which happens very often. It doesn't happen just in India, it happens in the United States as well. So trying to kind of how do we make it more palatable, but also empowering people with kind of some of what Swami has already kind of done a lot of the groundwork. So just you want to make sure that whatever he has laid out, even if you pick one of the numerous that he has laid out, that I think is the greatest service that a parent or kind of a friend could provide to an individual who clearly is experiencing some form of illness, whether it's mental, physical, or both of those together.
Spirituality is about believing in that higher power, believing in a supernatural force, and that's where faith comes in. What are your experiments with faith? With patients who have faith and patients who are not exposed to this whole idea of faith, because I think even for any youngster, for anyone to get into these practices, faith plays a very important role, isn't it?
Yes, it does.
What are your perspectives on this?
So I think, I've seen individuals who, again, it could be, we're not talking about religion, we're talking about faith. So I've had, patients who truly believe in a higher power, and they believe that, yes, kind of you really want to kind of, follow whatever commandments, whether it's a Catholic, kind of, making sure that they hold on to that faith while they're also in treatment with us as providers. That cohort always does much better compared to the group that clearly just comes in and say, okay, I've got to have a problem and I need to take my medication. So we've seen that kind of day in and day out. So that's something that's clearly for me, as especially kind of knowing the interconnectivity between the three the components of mind, body, and spirit. It's a no-brainer for me. Kind of, I've seen that. And so it's so much easier. But again, faith is not something that can be kind of, drilled into people, right? So it's got to be spontaneous. But then how do you meet them halfway? To be able to get them to kind of work towards it. I think that's important. And it's like, here, I know that when we were working at the medical camp, we would come in, kind of, do our work, whatever it is that the individual came in for, make sure we made the right diagnosis. If we had the medications, we'd provide those medications. But at the end, we also provided vibhuti, right? So giving that vibhuti is the faith component, is how I looked at it, kind of a proxy for faith. So I think those who got vibhuti, kind of clearly everybody got it here. So it makes a big difference compared to kind of, those who clearly just got a medicine. So I think that's important for us to take a look at. And I think it varies by societies as well.
True, absolutely. I mean, once faith happens, then experience automatically follows.
Yes, it does.
and in your life also have seen so many such experiences.
Yeah.
Where your family members were saved.
Correct.
It is just calling out to him and having that
absolutely
faith, and maybe you should narrate one or two of that.
Sure. So this is during the time that my father had a heart attack, and so I was kind of clearly in the state of South Carolina. My sister had my father in the state of North Carolina, which is about a 3.5-hour drive. And we rushed to where he was. He was hospitalized, and we chanted the Gayatri from the 3.5-hour trip that my mom and I took to the state of North Carolina. Get to the hospital, and so got to meet the cardiothoracic surgeon who had come in and laid eyes on my dad. And it so happened that he kind of starts to narrate this. He said, I was not supposed to be here, but the doctor who was supposed to be here couldn't make it, and so I'm the covering physician. Lo and behold, this gentleman happens to be the individual who has done the maximum number of cardiac bypasses in the state of North Carolina. So that was a blessing in itself. Of course, the Gayatri chanting had helped tremendously. Then, of course, they kind of presented the two options, which was either going in for a bypass or continuing medications. And had to make a tough decision, and we chose the bypass route. So he was getting prepped for the bypass, and the physician comes in and prays with us, which doesn't happen very often. And so he prayed with us, and then took my dad into the OR. So of course, those 6+ hours were kind of just tough for me and my family. Continued my Gayatri chanting, continued to chant Hanuman Chalisa during that time. Had a small booklet of Hanuman Chalisa along with a picture of Swami, which says, "Why fear when I am here?" with an Abhayahasta. Just held on to that picture and the booklet and just kept chanting Gayatri and clearly Hanuman Chalisa. And then the surgeon would come in every couple of hours just to give an update of what was happening to my dad. The surgery was completed, was successful. Of course, the next 22 hours were touch and go. And so I had the picture of the healing linga, which I put at the head kind of end of the bed that my father was in. And I happened to kind of, from within my purse, happened to reach out to this little booklet that I was holding on to with Swami's picture. And then there was a spray of vibhuti coming from Swami's hands. And of course, my father continued to kind of do well, recouped, had his cardiac rehab, has continued to do well thus far. It's all because of Swami's grace. And that again kind of, demonstrates to me as personal experiences that I've gone through, that, Dhrida Bhakti and kind of just the faith that you have in God, and He will never let you down. You've got to go through it. I mean, each one of us has had to go through challenges, but just being there for us. About few years ago, it was my mom. This time around, we were in Bangalore, and she got to be short of breath. No kind of, issues whatsoever until then, but got to be short of breath. And I was kind of, just sleeping in the same room as her. Had to rush her to a hospital, and of course, the pulse ox showed an oxygen level of about 77 at that time, which clearly would be a criteria for intubation. Was shipped to the ICU. She gets to kind of be in the ICU. I had to clearly wait out until the doctor got to see her, examine her. And then, of course, I was ushered in when the doctor wanted to speak to me. So happened that the same day, so we came to the hospital around 2:30, but the same day around 7:30, I was supposed to leave for Parthi, which didn't happen. And so as kind of the doctor ushered, I was called into the ICU, had the conversation with the doctor, and I was just sharing with him that, I had to leave for Parthi this morning, but of course this happens. And then this gentleman kind of, again, I couldn't see his face because he had a mask on. He looks at me and he says, I'm also a physician who works in super specialty in Parthi. Normally I'm there New Year's Eve through New Year, but this year I decided to go on January 4th. So all that we talked about was Swami. He showed a pendant that was materialized by Swami to me from underneath his scrubs. And then it was kind of just a great, conversation talking about Swami, which we all love. And my mother kind of, and continued, clearly there was a sigh of relief for her as she learned about this doctor clearly being in the Sai fold as well. And just like he had appeared, he disappeared. So I never got to see the doctor during the course of the 4 days that my mom happened to be at the hospital. So again, I see this as just, Swami being there in the form of this doctor and then taking care of my mom. And, clearly the fervor with which I prayed, having seen her kind of just gasp for breath, and he was there. He was there to rescue me. And clearly, which then resulted in her continuing to kind of, recover over the course of the next several days. So those clearly are experiences that I've been touched by in my own personal life. And for that, I'm indebted to the Lord for just kind of, watching out, taking care, and being there no matter how difficult times have been for us.
And it continues. When Bhagwan was physically there, you had the chance. Swami personally gave you vibhuti, and whatever he had instilled in you, it has only grown over the years, and you feel his presence stronger than ever before. It only gets reinforced every time something happens.
Yes.
And it's so nice to see you back in Prasanthi. Tell us your experience and what are you going to take with you from Prasanthi, and what is it that you feel now when you are in this Sannidhi in Prasanthi Nilayam?
So to me, I think it's clearly for everybody, it's been very different, how they experience being in the physical presence to kind of, clearly experiencing him everywhere now. To me, coming to Prasanthi, I come here every year. And it's just been the ability to recharge one's batteries. Because there are times wherein, you also go through kind of these, downward spirals, and it's like, oh my God, it's like, what is happening? And so just kind of being able to do that. And I'm reminded of this beautiful song, I think, which compares the Prasanthi Nilayam, kind of the bhajans, the chanting of the mantras and all of that, which really pervades, whether it's the roads in Prasanthi Gram or it is the environment here. And just being a part of that, just being here in the presence of that. And this bhajan goes like this. Bhajana Kirtana Nama Smarana Sai Pavanana Puttaparthi Pavana Triveni Sai Pavanana. So to me, it's like the Triveni Sangam, right? Coming to Prasanthi Nilayam, just cleansing ourselves, recharging our batteries, and then getting back back to the world and trying to just getting back to work, which clearly to me, work is worship, and just offering that seva with love and trying to do the best you can with, clearly Swami has given us so much in abundance. He's like the Akshaya Patra. A constant reminder of that. To me, it's like, often I ask myself, I have no wants in life. All that I need is just having Swami in our lives, having him always, and to be able to have that limitless MasterCard, I think is the greatest blessing that anybody could have for me in this Janma at least.
Amazing. Prasanthi continues to surprise you, and you didn't plan to come, and you're here and you shared for an hour. Really, really grateful to you. Very, very beautiful anecdotes and insights, and I hope it will definitely help a lot of Sai devotees in strengthening their faith and in being more serious in practicing Swami's teachings than before. Thank you so much.
Thank you.